My name is Dawn Shin, and I'm the Director of FEMA, Federal Emergency Management Agency. I am here today to address the public in regards to the recent influenza vaccine that was distributed between October 1st through December 15th. It has been brought to our attention through the CDC, Center of Disease Control, that the batches of vaccines have possibly been contaminated and are causing such symptoms as vomiting, diarrhea, high fever, and headaches. If not treated immediately, these symptoms can cause paralysis and possible death. I am here today to inform you of the steps we are taking to eliminate the side effects and severe illnesses that have been associated with this batch of the influenza vaccine. The vaccine was distributed to 21 states across the United States. These states include Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. The vaccine was released in September and was found to have mutated when contacted with the body's T cells within 30 days of injection. If you or a loved one have had the influenza vaccine within the dates of October 1st through December 15th, and are experiencing any of the symptoms mentioned, which again are vomiting, diarrhea, high fever, and headache, please report to the nearest medical facility or hospital in your area immediately so that you may be treated accordingly. We at FEMA are doing our best to mitigate the situation, but need the public's help to help us along further into why this is happening and what caused it to happen in order to rule out acts of bioterrorism. We ask that you do not panic because that will simply make things worse. It's currently testing the vaccine to see if there is something on our part that caused such a tragedy. They are also not ruling out bioterrorism, although this may not be the case. The CDC is working diligently to uncover the toxic pathogen and working quickly to secure an antidote. They are currently setting up a command center specifically in this time of crisis that may prove detrimental to human health. We ask that you do not panic, but if you have any symptoms, please come forward immediately and seek medical attention. We have come up with several ideas on how to control this outbreak so that it does not spread. We have established decontamination facilities and hot rooms for infected people. State and federal authorities are tracking symptoms in order to promptly identify specific groups of potentially infected patients. This approach's goal is to spot the geographic extent of infections as well as facilitating treatment. The CDC, in conjunction with state and local health agencies, inspire that medical help and other services are accessible and available during this time. For updates on the findings in this case, please visit our website at fema.gov. Our goal is to make you well and make you feel safe, so please do not panic. We will update you with the latest findings as soon as we are informed, and we suggest that if you live within the 21 states mentioned and have received the influenza vaccine and are experiencing severe symptoms of vomiting, diarrhea, high fever, and headache, that you please seek the help of the medical specialist or local hospital as soon as possible so that you may receive the help needed to further avoid worse symptoms. This has been a public announcement from FEMA on behalf of the CDC and Homeland Security. Thank you and have a good night.